Jeanette in the back.
Thank you, Judy. I appreciate it. Here, I thought we were going to talk about health. We're talking about economics. That's all we've talked about since we've been here, including Mr. Keck. But I want to go back to the slides, Mr. Keck, you were showing. Judy had 2 slides, so I'm assuming that the one that you dwelled on longest was really the underpinning of your argument that health insurance is not a principal driver of healthcare outcomes. But those were all people who had insurance. That's what we know what this discussion is about. This discussion is about the people who don't have insurance, who would be eligible under the new expanded Medicaid. I would love to see the map that showed those people who don't have Medicaid now, who would be eligible under the expansion, and what are their healthcare outcomes across the state. And I think that you would see that regardless of where they were and how bad the current Medicaid healthcare outcomes are, that the ones who do not have Medicaid eligibility right now would be even worse outcomes.
Look, that's why I showed that map. Look, I am not disagreeing at all. I'm not one of those people who believes that health insurance does not help. I'm not one of those people who believes that Medicaid hurts people. And the governor doesn't believe that either. Or else she wouldn't have put in $345 million last year of new money into Medicaid. She wouldn't have asked for 194, and it would be a little bit smaller this year for Medicaid. She wouldn't keep asking for money if she didn't think it worked. What I'm saying is that you've got to spend your money wisely. And if you're thinking about how you improve, what I hear here, and it's a fair argument, is a health insurance equity argument. It's not a health outcomes argument. The argument is everybody should have access to insurance. And that is the end point. No, let me say, this is not what the Affordable Care Act does. It's a health insurance bill. It says that everybody will get health insurance. Okay, so an equity argument is a fair argument. That's fine. But that is much different than a health argument. All those folks up there have equal equity to health insurance that I showed on my map. But they have wildly different health outcomes because of where they live, because of underlying social determinants that we could argue in South Carolina we should maybe be working on first. In Massachusetts, where they were at 93% insured before health reform, where they have one of the highest per capita incomes in the country, where they have one of the highest number of people graduating college in the country, where a lot of their economy is driven by healthcare, so it's surprised that they invest a lot in healthcare up there because a lot of it's driven by it. What I'm saying is that South Carolina and other states might be in a different position to say, let's think about alternative investments before we invest in this. Because there is a return on investment. When we talked about a broken system, I got the report right off the presses. The South Carolina Medicaid program. You know the number of kids that are getting their recommended well care visits in South Carolina for all the money we're taking? 24%. Good. You know the number of women who are getting their recommended breast cancer screenings in South Carolina, despite all the money we pay for them? 44%. Now, to say that when I said doubling down on a broken system, what I'm saying is that that's the system that we're going to pour more money in. And we're not asking much more in return for it. And all we're arguing is before we flood the market with money, we finally have gotten healthcare providers to start to turn their attention to making their profits, because all of them do, even the nonprofits. The CEOs of the nonprofit hospitals in the state make more money than the 0.1%. Turning their attention from focusing on revenue and market share and putting cranes in the air and buying new equipment. We finally turned it to health, we finally turned it to efficiency, but now we're going to flood the market with hundreds of thousands of new people that they're not going to be able to serve anyways. I mean, right now they're not even serving them. And they're going to turn their attention right back to how do we get my fair share, how do I get a crane in the air, how do I buy up more practices. The reason why Bamberg Hospital went out of business wasn't reimbursements. If you look at the number, I've been down to Bamberg several times in the past couple months. I was on the phone with the county council last week. I was in the governor's office talking about Bamberg last week. You know why Bamberg went out of business? not because they didn't have the reimbursements. It's because their patient volume has plummeted over the past 3 years. You know why it's plummeted? Because Orangeburg bought up the physician practices there and changed the referral pattern. Okay? And it's happening around the state. And so I'm in complete agreement with Representative Neal that we got to think about different models. But right now we're trying to pay Bamberg and Barnwell, a whole bunch of other people to be hospitals when people are driving on by that hospital and they're going to the Orangeburgs and they're going to the Tunians and they're going to the McLeods. And so what we've got to do is think about something different, a different model. But this doesn't help us do that.
Let me get some more audience questions in. Follow up, Frank. Go ahead, quickly.
Are you saying then that the people in the I-95 corridor who have Medicaid now, who your map shows, are at 50% of the poverty level and they have kids, so they're eligible? The one who's at 60% of the poverty level has no children, that their healthcare outcomes are just as good as the ones who have Medicaid? Are you saying that there's no difference, that the ones who have Medicaid?
No, I'm not saying that. I mean, and I believe
Well, then you're saying that
it's
the healthcare
a
outcomes would be
contribution.
better if they have Medicaid.
Absolutely, but at what cost? The question is at what cost? If I said it was going to cost $1 trillion, would it be worth it? So.
Let's get a question in from our audience.